midline in. Phalanx separating right here. Foot massage of the athlete. First doing a fleurage, checking the skin and superficial fascia. Visually skin is good, normal color, warm to touch. Checking for the skin mobility, a little bit of fixation on the outer side, heel area, fascial restrictions from the midfoot towards the middle ray, which leads us to the second and third toe, and connective tissue thickening at the first metatarsal head, hypomobile third and fourth metatarsal head, thickening of the fifth one, checking the mobility of the toes, bit of restriction and extension of all phalanges. The proximal and distal phalanx restricted for extension. Big toe, clearly we can see it. Overall mobility of the foot is decreased. Feels tight. Applying some oil and starting our effleurage. Wide, broad strokes. Warming up the tissue, skin, subcutaneous tissue, adipose tissue under the skin, and give a stroke to superficial fascia. Moving from the heel towards the toes. Several similar motions. 1, 2, 3, 4, and 5. Stabilizing the foot with one hand, which is my left hand, and applying a bit more pressure. Can use our dorsal surface of the fingers. Wave-like motion. First going along the fifth toe ray, fifth toe area here. C-shape movement, starting from the heel, moving almost to the middle. Straight and up, straight and up, straight and up, and doing same C shape over the big toe area. the way from the heel to toe. Adding extra lotion. Spreading it, going up, C-shape motion, just following the lines of the fascia. And returning. Now we're going to focus on the heel area. Round motion, following the shape of calcaneal heel bone. First, counterclock motion. And up towards Achilles tendon. That's where the attachment of Achilles tendon is. Compressing from both sides. Going down. Clockwise direction. And stretching. We can also stretch counter motion, starting from the center, moving away. So maybe thumbs moving away from each other. And up and down. Applying some pressure with volcanic stone. Moving towards the Achilles tendon insertion. Calcaneal tuberosity here. And mobilizing further. Noticing color change. Pressing. Release. Pressing. And again. And affleurage. Now we are moving to the inner medial side, adding extra oil, pressing, releasing, mobilizing the fascia, noticing the color change, and nice and smooth. Affleurage in the heel area. Move into the midfoot. Immediately can find some fixations. using my thumbs, one by one, from the heel through the midline and out. Heel, midline, in, out, in and out, in and out. Alternating our motion, and now hooking the area with the index finger and pressing, working directly on fixations. Just feeling for connective tissue adhesions, pressing and slightly moving my index finger, feeling for local heat, local hyperthermia, and moving further, pressing again and releasing. Helping myself with the acupressure tool. And release. And again pressing. Releasing and pressing, releasing. Moving a bit more medial. Now we can use the volcanic stone, press and glide, press and glide, from the midfoot towards the big toe. And pressing precisely on connective tissue adhesions. One, two, and moving further right here. Assisting myself with the tool and release. Helping myself with the acupressure stick. A bit of fascial spread and tracing the exact points, going up above. That's where the plantar fascia and intrinsic muscle of the foot start, following the direction. Next point. Almost between the metatarsal bones. Head of the metatarsal. Next space. Next one. And right where the head of the metatarsal bone is, applying pressure, holding it, stabilizing, and moving to the first space between the first and second metatarsal bone, applying more pressure and releasing. Last but not least, point in the medial side of the foot, compression, a little bit more, and release. Spread in both directions. Distal, proximal, distal, proximal, distal and proximal. Moving towards the toes, starting with the small one, the pinky toe. We remember there is a decreased mobility. We apply more flexion, doing gentle traction, placing the acupressure stick, applying gentle pressure, flexing, again traction, and extension. Next, applying pressure with the stick, base of the finger, flexion, pressure, extension. Moving to the third one. Here we have more mobility, flexion, extension, traction, a bit of hyperextension, flexion in all phalanges, and extend. Second toe. Good lateral motion, flexion, holding the distal phalanx, extension, again using my tool, flexion, extension, traction with hyperextension. Big toe, massaging the lateral surface, flexion, gentle pressure, extension, flexion over the stick, and extension. Pressing on the distal phalanx, using my volcanic stool, applying pressure, stabilizing the big toe, and release. Press and release. Right where the toe is connected to the foot, metatarsophalangeal joint. applying transverse pressure, pointing, and release. Head of the metatarsal, press and release. And hooking technique, holding it, pressing, moving, spreading the fascia, working with my thumbs. Doing lateral mobilization of the toes, helping with the other hand. Nicely spread, mobile, moving away from the interdigital spaces, applying lotion, effleurage. Working on the right foot now. Light effleurage and assessment. Moisturizing skin of the foot with the lotion. Right foot is as tight as the left. Even there is more fixation and less mobility over the fifth toe line. Facial restrictions right here under the head of the fifth metatarsal joint at the line of the metatarsal bone, the fifth one, and even the base of the metatarsal is also very limited in mobility. Continue with our effleurage. Linear motion. 1, 2. Going on the side of the foot. 3, 4, and 5. Lateral surface of the heel is thick. There is fixation, facial restriction of the outer side of the calcaneal area. Adding more oil, pressing, feeling for the tissue mobility. It's definitely less mobile here and there, and starting our circular motion around the heel. First again clockwise, 2, 3, 4, and 5. And counterclockwise, applying a little bit more pressure here. 2, 3, 4, and 5. Using 3 of my fingers, pressing the base of the fifth metatarsal, lateral side of calcaneal bone, working on the lateral group of muscles. Here's the intrinsic muscles of the foot, flexors. Pressing and releasing, pulling back to the heel, applying some compression with my thumb, and releasing. Already we increased the mobility, and now pressing along this line, using my acupressure tool. We can see dot-like trace. Showing that tissues are not hydrated as good as the left foot. Repeating the whole process. Pressing and releasing. And spreading the fascia, noticing the color change. Good vascular return. And now I'm going to use my volcanic stone tool, nicely hooking tissue around the base, 5th metatarsal bone, and moving forward, distal, returning with no pressure, adding some lotion, moving down, return, distal, nicely return, again distal, return, distal, and return. Doing the fascial release all the way from the heel, going down, back, going down, back, and again going down and back. Effleuration this area. Once again checking the mobility of the heel tissue. A little bit more soft tissue work. Improvement in color. Press, release, press and release. Cross tissue work using 2 fingers of each hand. Pressing. Release. Making my way to the midfoot, adding a bit of lotion, pressing, increasing the pressure, clearly feeling for adhesions right here and helping myself with the acupressure stick from the base of the heel, moving distally. Again, noticing the tissues could be hydrated more, pressing and releasing. Again, applying pressure, release, press, release, press. Here. Going medial, inner part of the foot, press and release. Outer part, press and release. Nice line, press and release. Press and release. Press and release. Spreading, rolling the stick, again applying pressure, effleurage. Now once again looking for the hypomobile joints. Definitely big toe is not as mobile as it could be. Just using my fingers to mobilize it, gentle traction, flexion, extension and lateral deviation. Lateral deviation of the foot, medial deviation of the toe. Toe in, foot is out. Doing it several times, feeling for the mobility in this joint. Extend and release. Keeping my index finger separating the big and second toe and working on the second toe. Pressing, gentle stretch, flexion and extension. Flexion and gentle hyperextension. And working at the base of the phalanx. And release. Going for the third toe. Pressure at the base of the phalanx. Separating. Pressing. Doing traction, release, press, traction, release, flexing, releasing. The fourth and the fifth, keeping my pinky finger in interdigital space, improving the blood flow, Pressing on flexors, clearly feeling flexor tendon here, flexing, extending, applying pressure to the base of the carpal metacarpal joint, base of the phalanx, proximal, the head of the metacarpal bone, metatarsal bone, fifth metatarsal bone, and traction, pressure, feeling that toes and the heads of metatarsal bone going separately. Here, fourth and fifth going apart. 1, 2, 3, 4, 5. Adding some extension to it. Holding and feeling the tissue stretched. Gentle traction and release. Using my thumb to stretch tissue distally, going along the tendons and tendon sheaths. Enhancing power of my hands, following the tendon sheath, flexor of the fifth toe, common plantar flexor, pressing, pointing, using my tool to mobilize it and make it even to the left foot. We still can notice traces rolling tissue up, proximal and distal. Pressing on the kidney point. And releasing. Another one. And release. And adding the fascial release with volcanic stone. Again, using my hooking technique. Manually feeling for tissue mobility. Tissue is way more mobile than when we started. Nice and warm to touch. Local hyperthermia in these areas where we released connective tissue fixations. Now it feels hot. Tissue is movable. Same as the metatarsal bones. they can be mobilized easily, flexing and spreading the transverse arch and releasing. The foot gets its natural shape. Toes are nicely separated. No efforts to keep them apart from each other. And holding the tissues here right at the joints. Moving my hand up. Inner medial side first. Middle. Coming close to the lateral. Once again holding the tissue with my index finger, moving myself up. Pressing. Moving up. Pressing again. Moving up. Pressing. And clearly feeling for the attachment of the flexors right here. Pressing with the volcanic stone tool. Release. Press and release. And pointy pressure with the wooden tool. Release. Adding some oil. Circular motions of my thumbs. Going up. Down, midfoot, down, midfoot distal, cross friction, thumbs, going opposite directions, and now 3 of my fingers moving down, sliding up. Just to mobilize the tissues completely, I'm gonna do fast connective tissue release. Switching my finger this direction. Hooking and moving apart, opposite directions, and proximal. Tissue is soft, warm, and mobile. Coming down the nervous system, slow, soft distal strokes, returning proximally, again slow, soft stroke, all the way to the toes, 1, 2, 3, 4. Here we have all the areas which helps our nervous system, balancing it and calming down. Four, 5. And gentle flourish. Okay, using the dorsal surface of my fingers. Distal, proximal, distal, proximal. Across.